Good morning, I'm Claudia Pitillo, and I'm happy to be here and to have the opportunity to talk about our activities on disease forecasting at FAO, particularly on Rift Valley fever. Protecting livestock against diseases and preventing their spread is one of the keys to fighting hunger, malnutrition, and poverty. And the FAO animal health mandate is actually to prevent, contain, and control the world's most serious livestock diseases at their source, while also surveying for newly emerging pathogens in a changing environment. Among our core activities, there are also early warning, forecasting, and early detection to enhance early action and response. Risk modeling and mapping in animal health is more than simply plotting the disease outbreaks on a map to produce a map of disease distribution. It's a process of estimating, understanding, predicting, forecasting, and displaying the risk of emergence, spread, and/or persistence of the animal health. And the risk maps can inform decision-making, support animal disease prevention, management, and control, for example, for risk-based surveillance, prioritization of vaccination, vector control, biosecurity, control measures to reduce costs, improve interventions, and evaluate the effect of medication. FAO is active on various diseases, including avian influenza, anthrax, Ebola, foot and mouth disease, and also on monitoring, forecasting Rift Valley fever. And the focus of this presentation would be on Rift Valley fever, where we have a lot of knowledge applied on monitoring forecasting. Rift Valley fever is a major zoonotic viral vector-borne disease which affects cattle, sheep, goats, camel, wildlife, and humans. It's transmitted by mosquito species, Aedes and Kulaks, but also through the contact with infected animals. Seasonal factors are influenced by environmental and anthropogenic factors. Any change in those factors, like prolonged and having rains, floods, but also droughts, and changes in the land cover, so agricultural expansion, irrigation schemes, can have an impact on the host, vector, pathogen, and environment system. And this can facilitate the emergence, spread, transmission of Rift Valley fever. So the disease has a strong environmental and dynamic component, the climate. Changes in the climate patterns and ecosystem can affect the host in terms of immunity, distribution, abundance, and movement, the pathogens in terms of resistance and selection of the host, the vector, so its distribution, abundance, and vectorial capacity, as well as the ecosystem, the environment, in terms of availability and accessibility of water, food resources, and shelter for the host and the vector. Some changes are expected to increase in the future due to climate change, favoring the introduction, spread, or persistence of Rift Valley fever, the human-wildlife livestock interface. Currently, the disease is limited to Africa, but there is a growing concern of geographic spread to Middle East, Europe, and even further. Over the past 10 years, FAO and partners, including NASA, WHO, and OIE, have successfully forecasted hotspots for Rift Valley fever vector amplification, providing recommendations and early warning messages for countries at risk of Rift Valley fever outbreaks. We have a dynamic model used at FAO, which is built upon the work by NASA, particularly by Dr. Nyamba, who developed a monitoring and risk mapping system that utilizes NDVI, so the Normalized Difference Vegetation Index, and rainfall anomalies as a proxy for ecological dynamics to map areas at potential risk of Rift Valley fever in East Africa. This model has been calibrated by FAO, and actually between 2016 and 2017, this calibrated model produced maps that are updated every month at 250 meters spatial resolution using satellite images, particularly MODIS, in a cloud-based platform, which is the Google Earth Engine. So our system, if you see the chart on the right, which shows the epicurve in green, would like to be on the left side of this epicurve. So to be able to identify those signs, those environmental indicators that then trigger major epizootic and also epidemics. Looking at the indicators. So we have developed an early warning tool that at the beginning was a prototype that was able to monitor and produce risk maps on near real time, maps of Rift Valley fever vector proliferation amplification using this platform, the Google Earth Engine platform. As you can see here in the screen, this is an example of the risk map produced by the prototype. And so we were able to transit from a desktop to a cloud-based platform, which increased significantly our prediction capacity during the past 24 months. So since we moved to the platform, we were able to, well, first of all, we have produced more than 600 Rift Valley fever risk maps for Africa, because we have models for calibration models for different regions. We have produced a number of risk assessments jointly also with our partners, NASA, WHO, IE, and also colleagues in the field. We have produced a number of alerts for West, East, and Southern Africa. These regular assessments are included in our FAO bulletins, like the food chain crisis and early warning, early action bulletins. And if you see in this table, you will see, our prediction capacity, because the table reports the countries with forecasted Rift Valley fever events, the date where we issued our assessment of alert, the date of reporting and observation of the outbreak. And on average, you can see that we have a prediction capacity of almost 2 months, in some areas even more. And this was possible because by moving to the Google Earth Engine, we reduced enormously all the pre-processing work for the satellite images. We have now 2 examples of the alerts produced by FAO and sometimes jointly with other partners, like NASA in this case. On the left, we have the alert that we issued for Southern Africa. We issued in February 2018, and the outbreak was actually reported in South Africa in May 2018, so a number of months later. On the right, we have the alert that we issued in April 2018 for East Africa, and in Kenya in June 2018, the Rift Valley fever outbreak was reported, so 2 months later. But is this sufficient to trigger early action? Because actually our scope is to produce risk maps in order to trigger response, early action and response. And actually we find out that this is not, it's very important to what we do, but it's not sufficient to actually trigger early action. We had a workshop in East Africa in 2018, immediately after the epidemic, discussing, the contingency plans and also the models and different aspects. In terms of the models and the tool, we find out that we have strengths but also challenges that we need to work on. Among the strengths, we know that, and it was recognized that the tool that we have is a real-time environmental monitoring system, very important, is cost-effective, is powerful. It's very important that we are able to produce risk maps on a monthly basis. These maps are also available, and they are accurate, particularly for endemic countries that have Rift Valley fever historic data that were used to calibrate the model. But we have also a number of challenges that we need to work on. First of all, we will need to have a validation systems, a real-time validation systems for the risk areas, identifying predicted risk areas. Would be important to have mosquito surveillance, sentinel herds, expert knowledge on real time, and which is quite challenging to have. For countries that have not reported yet the disease, Of course, we know that our prediction may be not so accurate because it's not based on real training data. What is important to work on is also the establishment of a network of experts to discuss the risk maps and update on the Rift Valley fever situation on near real time, and have data sharing to assess the occurrence, the spread based on effective exposure. Because, for example, number of animals, vaccination, movement, trade are still information that are not fully available. It would be also important to work on quantitative risk assessment, integration of those risk factors that we have with other risk factors, particularly in the socioeconomic, to really assess and quantify animals and humans and risk. And what emerged from this workshop that was quite crucial and important is that risk maps at country level, at field level, are difficult to interpret. And what would be very useful is to associate to those risk maps also key messages related to recommended key messages in order to facilitate early action. In East Africa, there are a lot of information, data, and a lot of work has been done in relation to contingency plans and preparedness. Particularly, there is a publication by ILRI and FAO on the title is Decision Support Tool for Prevention and Control of Rift Valley Fever, Epizootics in the Greater Horn of Africa. This publication, which is a paperwork, I mean, all the phases of the cycle of the disease are very well described, and for each phase of the cycle, recommended actions are very well described and associated to each of these phases of the cycle. But unfortunately, I mean, this information are not digital, not yet integrated to risk maps. So what we realized, particularly during this workshop, was that it's very difficult during an emergency phase to find out paperwork, I mean, documents where, I mean, all this information are very well described, but still it's in an emergency, it's difficult to dig and find those information. So it would be much better to have those information immediately available. And so following that, we proposed a project where one of the activity was to develop a decision support tool which integrates the near real-time Rift Valley fever risk maps, the model that we have already developed, with relevant geospatial products, classification, expert knowledge, assessment of the risk, and particularly and mostly the recommended actions, particularly for those documents that we mentioned before, in order to guide appropriate response to Rift Valley fever at country level. Target countries, pilot countries were Kenya, Uganda, Tanzania, but we would like to expand this to other countries at risk as well. This was developed within a project that was funded by the Irish government. And we are finalizing the tool. We are almost done. And we already got some achievements, some results, because, for example, Rwanda recently vaccinated almost 70% of livestock following a foul alert. Based on these risk maps, we have also better coordination within FAO among our unit, the Emergency Management Center, with incident coordination group activated and response mission in target countries. But still, there are some gaps and data needs that would really improve our decision support tool, but not only the one developed for Rift Valley fever, because this one is just an example. I mean, this tool could be expanded to include other diseases, other animal threats. those that are maybe more related to environment, to the climate, but also others than socioeconomic. In terms of gaps and data needs, it would really important for us to have real-time data on flooding, for example, irrigated areas, observed and forecasted climate data like rainfall and temperature anomalies, including also dry spells. And in this case, we have information data on rainfall, but this is sometimes not really real time, not real time available. So having really real time will help a lot. Other information in relation to identification of oases in arid environments, because, for example, with the current outbreak in southern Libya, these habitats that are very suitable for vectors, but also they represent congregation areas for animals and humans as well, where the spread of the disease can increase dramatically. It's very important to map. Information on markets, villages, and road network would be very important for modeling the spread of the disease. And also, we will need novel methods to integrate data-driven models, machine learning, and expert knowledge. And with this, I would like to thank the colleagues that contributed to this work. There are many, and over many years, and also the donors that allowed us to work on that, including the Irish government and the USAID. And I would like also to thank you for your attention. Thank you very much.